my name's Kara. I'm going to be your student nurse today. Can I have you confirm your name and date of birth? Perfect. So it looks like on your MAR here we have orders for a Foley catheter. Are you familiar with a Foley catheter? Perfect. Do you have any questions I can answer for you? All right. Well, if you think of any questions, don't hesitate to let me know. Are you allergic to anything? Okay, no shellfish, iodine, latex allergies? Perfect. All right, so I'm going to foam in and then put on a pair of gloves. And I'm keeping my hands above waist level, but because these tables don't rise that high, we're gonna have to kind of verbalize that, but okay. So I'm going to bring this over. I'm gonna put a bath blanket down below the patient, and then I'm going to fill this basin, and we're going to start by spreading the labia and cleaning it. Oh, we'll roll this back actually. Spread the labia, and we're gonna clean it down one, and then left side and right side. All right, so I'm going to remove my basin, remove my gloves, wash my hands, and then we're gonna come over here and start preparing the sterile equipment. So my hands are washed. I'm going to start by peeling this back away from me without going over the sterile field. This down, and ideally this table would be larger so that this would lay flat, but this is what we have to work with. So there, and then line back. And then I'm going to grab the sheet here to place underneath the patient, and I'm only touching the outer edge of it. All right. And then I'm going to grab my sterile gloves and open them outside of the sterile field. Again, my hands would be above waist level, but for purposes of this, I'm doing what's available. So this is, I'm only touching the outer cuff on this glove, or the inner cuff, just the inner cuff with my bare skin. So ideally I would have a brand new set of gloves, but since this one isn't, I'm just gonna help my hand along in there, but I recognize that I would not be doing this in real life. I would only be touching the inner rim, but for demonstration purposes, this is what we'll do. And then this glove is sterile on the outside because I had not touched it. And so I will be grabbing only the outside of the cuff on this glove and not letting my skin touch the outside at all. Now, because this glove is sterile and the outside of this glove is sterile, I could potentially help a little bit along in there, but I cannot touch the outside of my skin with the outside of these gloves. So, going to throw that in the trash. And now we're gonna come over here and I am going to separate my two kits here, but keeping them both in the sterile field. So, I'm not going to turn my back on the sterile field at any point. I'm going to attach the sterile water to my Foley catheter here to inflate the balloon. And at this point, I'm going to also remove the plastic. And then I will discard that. And then I'm going to put some lube into my small tray here so that when I am ready, I can just put the catheter into the lube. And then I'm going to bring both of these over to the sterile field here beneath the patient without them touching the outside. And so I'm going to pour the betadine onto my cotton balls, and then I'm going to take one, go down, discard without going to like over my sterile field, go down, discard, and then grab another one, go down, discard. Then I'm going to put the tip of the catheter into the lube that I had put out, and then I would instruct the patient to take a deep breath. I would insert the tip of the catheter 1 to 2 inches, check for residual urine flow into the catheter, and then I would advance the catheter approximately 1 more inch. Then I would take my sterile water, inflate the balloon, give it a gentle tug to make sure that the catheter is in place. I would take the tubing of the bag. This is when I would also remove my sterile gloves after this part, as I would put a cusp around the patient's leg, or the strap to hold the catheter in place with a little slack so that it doesn't pull. I would hook the catheter bag onto the bed, but not onto a movable railing. Then I would document my intake and output correctly, and I would ensure the patient has privacy, ask if they have any questions. I would document the size of the catheter, when the catheter was placed, who placed the catheter, the type of catheter, and then any abnormalities I may find, such as if the patient is in pain. Before I leave, I'll make sure that the patient is not in pain, is not feeling uncomfortable, and leave them with their call light, the bed brakes on, and the railing up with the bed in the lowest position. Any questions I can answer for you? Are you feeling all right with everything today? All right, good. Well, here is your call light. So if you need anything else at all, you just hit the button and I'll be right back in to check on you, okay? All right.